Today, we have the honor of sitting down with Dr. William Li, a renowned cancer researcher, physician, and scientist who is also the author of 2 New York Times best-selling books, Eat to Beat Disease and Eat to Beat Your Diet. Dr. Li initially rose to fame in 2010 for his TED Talk, Can We Eat to Starve Cancer?, which has racked up over 11 million views. His groundbreaking research has led to the development of more than 40 new medical treatments that impact care for more than 70 diseases. In the last couple of years, his influence has skyrocketed across social media, and he now has nearly 1 million followers combined across platforms. We believe today's episode is one of the most important we've ever done, as it centers around one of the most pressing issues of our generation, cancer. Historically, cancer was known as a disease that people got later in life, but that has quickly changed. In the last couple decades, cancer rates have risen significantly among people 18 to 49. It feels like every week we see a new story about another public figure who's under 50 that has been diagnosed with cancer. Most of us have become aware of this reality, and thus, cancer has become one of the most feared things in our society. But it doesn't have to be that way. In this conversation, we review the latest data, how cancer works, and the defense systems in the body that protect us against cancer. We then get into how we can actually prevent cancer from manifesting in the body through food and other lifestyle interventions. And then finally, we talk about screening for cancer and the most effective breakthrough treatments if you've already been diagnosed. This episode is an absolute masterclass in cancer. We believe that after listening today, you'll leave more informed, equipped, and empowered in the fight against this disease. But before we begin the episode, I want to take a moment to acknowledge our sponsor, N2 Water. If you've been following us for a while, then you know that our mission revolves around holistic well-being, mind, body, and spirit. And physically, a big part of being well means optimizing your health through proper nutrition. However, achieving this can be challenging in a world dominated by ultra-processed foods. That's why products like N2 Water can play a vital role in helping you rewrite the narrative and take control of your own health. N2 Water is a hydration powder designed to turn your daily water bottle into a powerhouse of essential minerals, ensuring you receive the vital nutrients lost in today's world of ultra-processed food. N2 Water is made up of 5 simple, high-quality ingredients, and is harvested from mineral-rich seaweed off the coastal waters of Iceland. The main nutrients you'll get from N2 Water are calcium and magnesium, which are essential for our health. Together, these nutrients play a role in protecting our bodies from the chronic disease epidemic plaguing the Western world today. Magnesium supports over 300 biochemical reactions in the body, and calcium helps the blood clot normally, muscles and nerves to function properly, and the heart to also beat normally. Personally, I believe optimizing nutrient levels is one of the most foundational steps you can take for your health. In fact, recently I even did a micronutrient panel, and I discovered that calcium was actually one of the nutrients I've been deficient in. According to the CDC, over 92% of the population is deficient in at least one vital nutrient, and 70% are deficient specifically in calcium. What I love most about N2 Water is not only does it supply vital nutrients, but it actually tastes good. My personal favorite is lemonade, but grapefruit, margarita, and peach lemonade are 3 other delicious flavors. Just add a stick pack to your daily water bottle and start enjoying the benefits. We only partner with companies that align with our mission and have full confidence that they will serve you well, which is why we're so excited about N2 Water. You get 20% off by visiting n-2water.com/mightypursuit and using early sips at checkout. Again, that's n-2water.com/mightypursuit and the code early sips at checkout. We'll also be listing this below in the description and show notes for easy access. And now let's get back to the show. William, thank you so much for being here.
Thanks very much, Matthew.
Yeah. I think, a few topics are more relevant today to the health conversation than cancer, especially with like the latest data. And I couldn't think of more people that were qualified to talk about this just from a holistic standpoint. And I really admire your background in the subject. And we were talking offline how there's, a renewed interest in preventative medicine and functional medicine. And I love that you bring kind of the lifestyle and food picture into this, but then also, the value in this conversation of things like surgeries and medications and all the other breakthrough therapies that are around it. And so I kind of wanted to ask, like, as we kind of broach into the conversation and we take a holistic look at this, like, what do you think the importance is of looking at this from like an integrative view with all these things on the table?
Yeah, well, first of all, thanks for having me on. I think this topic of cancer is a great way to focus on what the bigger pictures are in medicine in general. But cancer is such a life and death and feared kind of condition that everyone has been touched by it, and everyone has some understanding of cancer, usually a fairly narrow one. And so here's something that I think is important for everyone to know. I'm a cancer researcher. And when I started out, we just viewed cancer as a problem in an organ with a mutation where the cells go wild. And pretty much you have to destroy the tumor, the cancer, if you want to treat it, hopefully successfully. But usually it wasn't successful. And, fast forward a couple of decades, and I can tell you that now we have a completely different view of cancer. Cancer is actually very normal in people. We all form cancers all the time in our bodies. The thing is that, and the reason that we do that is because our bodies are composed of 40 trillion cells that have to copy and paste, divide each, so that we're still around tomorrow. The only reason we're around today is that we were copied yesterday for today, and then for today for tomorrow. And all these copy pastes, this duplication of cells, can lead to errors. And every time you have an error in copying a cell, you wind up having the potential for a microscopic cancer. So let me give you kind of an example of sort of how difficult it is to control this. If I gave you a sentence to copy 10 times on a word processor, okay, you'll do it perfectly, all right? If I asked you to copy it 100 times, you might still do a pretty damn good job, but you might make one or two errors. If I asked you to copy that sentence 40 trillion times, you are definitely going to make mistakes. Errors, yeah. Now, do you know how many mistakes the human body makes in copying its DNA, its cells, every 24 hours? Take a guess.
Probably not a lot, but or it might be a lot.
Well, this has been studied. Every day, our body makes 10,000 genetic mistakes in copying every single day. Now, that's actually a relatively small number compared to the 40 trillion cells, but I will tell you, each of those 10,000 mistakes is a setup for a microscopic cancer. So I use the word microscopic because it's one cell that has a problem, and it can grow just to be about the size of the tip of a pen or pencil point. Okay, then it can't get any larger. Part of the reason it can't get larger is because it doesn't have a blood supply. It's just sitting there. In order to grow, it needs oxygen and nutrients. It needs air and food. And so it just gets to that size until our body's anti-cancer defenses, which are our health defenses, basically take care of it. So how is it that our microenvironment is really how we're beginning to understand cancer? You got a cancer cell that's abnormal, and then it's sitting in an environment that protects the body. The body protects against cancer by cutting off the blood supply so it can't grow. No food, no oxygen, all right, no air. The body also has kind of a cement-like structure around it, so it can't enlarge very easily. And then we've got an immune system that wings by like cops on a beat, all right, to conduct surveillance. So whenever an immune cell sees one of these microscopic cancers, it is like a police cruiser in a neighborhood, suburban neighborhood, seeing a drug dealer sitting on a street corner. They don't even have to be dealing drugs. Okay, they should be sitting there. And what does the cop do? They put the guy in a paddy wagon and take him away. And that's what our immune system does to clean up our body. So, the fact that we do get cancer, clinical cancers, is because some of these health defenses have failed. Your immune system goes down, you have too much inflammation, blood vessels start growing towards the cancer, and that's actually how cancers can actually start to grow. So because this is a complicated ecosystem with a lot of things that bear on whether or not you develop cancer that could become dangerous for you, big cancer, that's why integrative medicine is important, because the traditional way of looking at a cancer patient or looking at a patient without cancer. All right, I'm a medical doctor in internal medicine. I can tell you is that you don't have cancer until I diagnose it. All right, but yet I'm just telling you that we do have these microscopic cancers all the time. The conventional doctor, the standard kind of like, I would say the cardboard cutout doctor that could be very well trained. They'll say, come to me if you have blood in the urine, blood in the stool, or blood, in your skin, or something that we would actually then want to work it out, right? Then we'll scan you and to see if there's a problem. The integrative doctor says, oh, wait a minute. We need to boost your immune system at all times and keep your inflammation low at all times. And we need to make sure your circulation is good at all times, but not to tumors. And that's the kind of integrative approach that is actually changing the way that we think about preventing cancer, treating cancer, and also, literally curing cancer as well.
That's really good. Yeah, I think, are you familiar with Steve Jobs' cancer case?
Yeah.
Yeah. And, I thought what his case was very interesting. As we're talking about all the fusion of all these things. And so for people who are not familiar, he was diagnosed with pancreatic cancer in 2003, less aggressive type. And then he opted for like alternative medicine or modalities for 9 months. And so a lot of people say that didn't work. And then he eventually chose to have surgery. And then he kind of struggled with the cancer for like 8 or 9 years. One of the heads of Memorial Sloan Kettering Cancer Center, she said, Jobs' faith in alternative medicine likely cost him his life. He had the only kind of pancreatic cancer that's treatable and curable. He essentially committed suicide. I thought those comments were like really very pointed, but just the idea of looking at the full spectrum of how do you actually treat this thing. You mentioned that we have microscopic cancers in our body all the time, but when it like manifests into like a full-blown disease, like what are your thoughts on those comments of people thinking when it comes to cancer that trying to do lifestyle intervention or alternative medicine is just something that's going to, I don't know, not work. And so why would we do that?
Well, it's a complicated question because, I think when you're dealing with something as serious as cancer, you want to actually pull out all stops to be able to overcome your disease, control it, overcome it, reverse it. Okay. And what I would say is that most people who go with their standard oncologist, and I'm talking about the oncologists that were trained 20 or 30 years ago, they're going to get chemotherapy or radiation or surgery. Those were the mainstays of treating cancer. And those are the conventional, traditional cancer therapies. Well, about 15 years ago, there's a whole new area of cancer treatments that started to come out. Now, I've actually been involved with helping to develop over a dozen types of these new cancer treatments. They're called targeted therapies, not chemo, not radiation. They actually aim like a smart bomb at some aspect of the tumor. So for me, my skin in the game was actually trying to develop ways to cut off the blood supply to tumor or anti-angiogenic. So anti-angiogenic treatments, okay? And they work. They don't work alone. You want to actually combine, you don't want to throw the baby out with the bathwater. You want to combine something new with the best of whatever already exists. And I think that's the best way to think about how to take advantage of cancer therapies. Now, what about the topic of diet and lifestyle? Okay. Now, obviously, what we eat dramatically impacts what's happening inside our body. Whatever we feed our body's going to respond to it. And if you put something bad in your body's going to respond badly. Perhaps flare up inflammation. Now, that's a really bad thing if you've got cancer. And if you put something good in it, your body might light up its health defenses, raise the immune defense, cut off the blood supply to tumors with anti-angiogenic foods, so on and so forth. And so this integration is really part of it's a tool in the toolbox. It's not to be swapped out. Now, I have to say a little bit, which is I was involved with Steve Jobs' case, so I know a lot about what you just set up.
Okay.
All right. And he did receive an anti-angiogenic therapy, and it actually did work for him. And, his situation was complicated because back then there were fewer treatments compared to what we actually have today. So, that's how fast cancer therapy is moving. And so I think for anybody listening, The word cancer is a very scary one. It's the one condition that everyone wants to avoid, dodge if you can. All right. And if you have it, it's so scary because you think that there's no hope. Well, I can tell you as somebody who works at the frontier of cancer research and treatment that in my career already, I have seen how cancer can be cured, because I've had well over a dozen patients who went from stage 4 to stage 0 when it comes to cancer. Stage 4 is game over. And I'll give you some examples of specific cancers. There's a woman in the Midwest who had glioblastoma. That's a deadly brain tumor. Okay. Stage 4. Nobody lives longer than about 1.5 years or 2 years with that. She's alive 7 years later, and not just alive, she's thriving. It's amazing to see. And she got immunotherapy, a vaccine that actually helped prime her immune system to go after the cancer itself. My own mother, at the age of 80, had endometrial cancer, a cancer of the lining of the uterus, spread everywhere. Okay. Stage 4. All right. Game over type of treatment. She was 80. Her oncologist told me it would be, the treatment would be worse than the disease. Why don't you take her on a cruise, while she's still feeling well, and enjoy some time with your mom? And I looked at him in the eye and I'm like, do you know what I do for a living? This is where I eat this stuff for breakfast. This is where my day begins. So we got her at the time on a brand new immunotherapy, jacks up your own immune system. All right. And for my mom, we used diet. We optimized her gut microbiome. We gave her medicines and foods to lower inflammation. Got to get it all right. It's the entire environment, the entire ecosystem. And remarkably, she had 3 infusions of this immunotherapy. Each of them took 20 minutes. They were spaced 3 weeks apart, so by 9 weeks. So we scanned her at the very beginning, cancer everywhere. All right, liver, lung, you name it. At the end of week 3, and for her, she had really no side effects on this immunotherapy. At the end of week 3, we rescanned her, 0. And that was a decade ago. And, I just had dinner with her the other night. She doesn't even remember she had cancer. So I've seen the end of this disease up close in my own family, as well as a number of different patients that are out there. Another person is a 40-year-old with lymphoma. All of her regular doctors said, we've gotten to the end. There's nothing else we can do. She wound up getting an immunotherapy, her own immune cells that were drawn out, sent away, engineered to be super soldiers. And she got 1 bag of her own immune cells, her own jacked up immune cells. Took about 25 minutes to go in there. She got done, rang a victory bell. All right. And about 9 weeks later, went from end stage to 0. And she's completely back to normal today. So what I'm telling you is that the integrative approach, and of course, all these people have wound up having diet and lifestyle tweaks, modifications, adjustments. None of them would have made it, by the way, if all we did was say, just have a bowl of salad and you'll be fine. Yeah. Or say, let's just do ketogenesis, you'll be fine. All of these success stories that I've seen personally as a doctor, as a cancer researcher, have been the result of integrating the best of what we got in terms of medicines and the best of our knowledge of what we can actually do in terms of the foods that you eat and the foods you don't eat, as well as diet as well. Now, let me just be really clear. We don't know how to do this yet for every cancer patient, but the breakthroughs are happening, and any advance of medicine happens one patient at a time. So for me, I already can see the end is going to be in sight. We know how to we know what works. So for anybody who basically is struggling with a disease like cancer, what I would say is that absolutely you need to actually think about your diet. You need to think about your lifestyle, little tweaks to actually get your body in prime position. And you need to ask your oncologist about immunotherapy and targeted therapies.
That's really good. Yeah, I mean, that is just absolutely mind-blowing to go from stage 4, what seems like a death sentence for the vast majority of people, and then just have it go away completely. Is just...
And not come back.
Yeah, that's... I mean, that provides a lot of hope for people for something that is so feared like cancer. And so, you know, we're going to cover the full spectrum today of like prevention, you know, therapies. You mentioned immunotherapy. We'll get to that. Um, when it comes to like the latest data around the subject, I think what the thing that everybody is hearing about, obviously, is, I mean, even if you look at a chart, just like the explosion in the number of cancer cases versus, and so what's the risk of an individual today developing cancer in their lifetime? What's the latest data around that?
You know, so these cancer statistics that we're seeing, the rise in cancer cases, and also the earlier cancers, younger people are getting more cancer. This is sort of an evolution that's happening. It's kind of a tsunami that we're starting to see on the horizon, right? So you remember, you know, the picture of that, in Indonesia, you know, the beach, and you can kind of see the wave coming, forming in the distance. Like, this is what we're actually seeing with cancer. We don't really have a clear explanation yet of why. There's a lot of ideas that are out there. The climate, the environment, the pesticides, the microplastics, the additives in our food. I mean, the sedentary lifestyle. I mean, it could be a perfect storm of all these different factors. I don't think there's one guilty party, but there's something clearly going on that is awry. I mean, you know, I heard the other day of a teenager getting colon cancer, which is like unheard of. You know, when I went to medical school, you would never see anything like that. But this is the kind of thing that's actually happening. But what are the statistics? Well, you know, if you look at the American Cancer Society, basically you would say 1 in 3 women and 1 in 2 men are going to develop cancer in their lifetime. That's a very crude averaging of lifetime cancer risk. That means, look, there's you and me, 2 men, all right? One of us is going to get it. Add some women in the room, 1 in 3. Go into an elevator with 10 people, all right, like 2 or 3 people that are going to get cancer. So these are the stunning statistics that make people really scared, except there are clearly things that we can do to prevent cancer. And a lot of people don't know this, but that only 5 to 10% of cancers are due to genetics. The rest is due to environment, diet, and lifestyle.
Yeah, I think that's the one big thing that seems to be highlighted. I mean, if you were to look at and this is a lot of what Dr. Casey Means talks about, but if you look at a chart and see this tsunami that you're talking about with the cancer cases, and then you would also chart, you know, the explosion in fast food restaurants and ultra processed food, in pollution in our environment, like you're seeing these things go up. I mean, it's not exactly like you're studying in a lab and like this is exactly what's causing it, but there's like this correlation of things that you're seeing rise. I think the thing that's most surprising to people probably is specifically what you were saying with young people, like there's a 79% rise in cancer rates amongst young people defined under 49 years old. And and then you just mentioned the cancer case with the teenager. What would be happening like for that specifically? I mean, people thought it was like an older person's disease. Like, what would specifically be happening that there would be a rise in people that are younger now that were?
Yeah, I mean, putting the kind of pinpointing the cause, like single cause. We haven't been able to figure it out yet. But I'll tell you on a personal level, as a cancer researcher, some of the things that I think about. Yeah. I think that's fair enough. You know, I think that with the way that we have put so many additives in our ultra-processed foods and how common that is, and the way that our water supply has become contaminated with microplastics and nanoplastics, which are clearly inflammatory. And inflammation is sort of sets up the environment for cancers to explode in terms of its growth. I think that it's hard to say that kids leave a sedentary lifestyle, but hey, you know, if you're a gamer, you're sitting in your chair all day long. You know, that's kind of sedentary. That actually can contribute as well. All these things kind of like degrade your immune system, cause more inflammation, sort of tip the balance in your body just in the wrong direction that would favor cancer. But I do think there's probably more going on than that. But those are clearly some of the factors. I think the gut microbiome is another one, because I do research on the gut microbiome. So for people who are not familiar with this, the gut microbiome are the healthy bacteria that live inside our gut. There's about 39 trillion of them, all right? And where do they live? They live in the colon primarily, which is sort of the last third of our gut. They live specifically in a little pouch called the cecum. Cecum is right where the appendix is. And we used to think the appendix was useless. If somebody getting like a surgeon, if they were in a child's belly or a teenager's belly for whatever reason, they saw the appendix, they'd go, whoop, snip, let's take it out. Don't need that. That's like a extra piece of skin. Well, we're beginning to rethink that, because maybe, just maybe, the appendix plays a role, just like our tonsils play a role in our immune system. And one of the things that we're beginning to think is perhaps the appendix has an air traffic control function with the gut microbiome. So the gut microbiome lowers inflammation, raises your immune system, controls healing in your body. And I do think that this is something we've only really begun to recognize seriously in the last, let's say, decade and a half. A lot of the factors that you mentioned, the pollution, the contaminants, additives, all of those things actually, almost all of them can negatively affect the healthy ecosystem of our gut microbiome that we need to lower inflammation.
That's really good. Yeah, I think that, and we'll get to the in your first book, the way that you outlined all the 5 defense systems in the body, I thought was just so interesting, because a lot of people are not well versed in what those defense systems are. And then even the treatments that you were talking about when it came to cancer and the defense systems in the body. I mean, obviously the microbiome is one of them, but then when it comes to the immunotherapy and then also angiogenesis and targeting it that way, I think is interesting. And so, yeah, I mean, when it comes to like the on the front end, when you're talking about the risks and what is actually like causing this, is there anything else you would add about like modern life that you feel like, we're going to talk about food, but like would be things to be aware of that maybe we could counteract in terms of being proactive?
Yeah, there's a lot that we could actually unpack there. Some of the basic things I would say is that you hear a lot about superfoods, in quotes, and everybody's trying to sell their own favorite superfood or super supplement. What I say is that there's no single food or supplement that's really super. It's the human body that's really super. Like, we have these incredible defenses in our body, and I write about 5 of them in my book, Eat to Beat Disease. They actually are what is responsible for our health. Our health isn't just the absence of disease. Our health is the product of our health defenses firing on all cylinders. It's kind of like, health defense is kind of like home defense, you got your lock on your door, you got a fence at your gate, you got a burglar alarm, you got a fire alarm, a smoke detector, a latch on your window. All these things prevent the bad guys from coming in, okay? And in the body, our health defenses prevent those bad guys, the diseases, from overtaking our body, from home invading our body. But you wind up actually leaving the window open, keeping the door unlocked, turning off the alarm, let that fire alarm expire, the batteries don't work anymore, or the smoke alarm. And when something happens, it could actually wind up having a real negative consequence. So what I say is that the things that we need to do are eat foods that boost our body's health defenses. And I've listed tables, pages and pages of foods that can do this. And at the same time, you want to avoid foods and lifestyle practices that degrade or destroy your health defenses as well. Cuts both ways. You can raise the shields, you can lower the shields. You don't want to be lowering your shields. So some of the things that are very clear in my mind to be able to stay away from. Now, my research is actually what you should add to your life to enhance your health. I try to spend less time kind of bashing foods. In fact, I don't really like to bash foods. We're all human. We all like to do the things we like to do. If you spend more time eating good stuff, you have less room to eat bad stuff.
Yeah.
But I will tell you, some of the clearly bad players, many ultra-processed foods have a ton of additives in it. Just take a look, a lot, and I think this is a good practical take-home for anybody listening or watching this. If you're buying something that's in a box or a bag or a can or frozen in the frozen section, you pick it up before you put it in your cart. Hold it up and look at the ingredient label and see what's in it. I'm not talking about the macros, like the protein and how much fat and all that. Like, that's important, but I want to look at the small print, the stuff that they try to really make so small it's hard to read. Sometimes for me, when I do that, I actually have to take a photograph of it on my phone and then enlarge it with my fingers. I just expand it so I can see what's in there. I want to know how many additives are in there. And recently, the FDA, the US FDA, removed red dye number 3 from the food products. They banned it. Well, 30 years ago, if you can imagine, was when we all first realized that red dye number 3 can cause cancer. And yet it's been left in our food supply for 30 years, 3 decades. We're talking about, like, what are some of the possible causations for this rise in cancer risk? And by the way, the other thing that's kind of nuts is that even though the announcement of the ban was made on, one day, the government is giving permission for the food companies to have for 2 more years on the shelves until they can figure out how to swap out red dye. Now, I can tell you, it doesn't make any sense to me. Like, you should take it off the shelves immediately. Once you deem it's no good, especially for something like cancer, why wouldn't you just remove it immediately? Let the food companies figure out how they're going to fix that. And then consumers can feel more trust in the system. And I think this is a whole other dimension of what is being discussed today, is how do we learn to trust our food system? Where do we get our information from? Who are the voices that really know what they're talking about, as opposed to, delivering a message that may or may not be true, may or may not be trustworthy? So on top of all the other factual things that, we've been talking about when it comes to cancer or health or environment or exposures, I think we've got this other layer of complexity, which is, how do you find trusted resources to get information that is true?
No, that's really good. Yeah, no, I think the paradigm of thinking about, like, what we're adding, what we're avoiding. I mean, I think about the red 3 dye is kind of crazy because of how many other dyes are out there that are existing that potential have health implications. And so, as we get to the defense systems of the body, I think what's really interesting, you were talking about, obviously, that we all have microscopic cancers in the body. I think one of the phenomenons that scare people the most are someone seems to be fine and non-symptomatic, and then all of a sudden you hear about people that are just hit with a stage 4 diagnosis, especially if they're like 37 or something like that. What would be happening in the body for something to go from a microscopic cancer, and then all of a sudden you're at stage 4, but you don't even feel anything yet? And then, I don't know, people like freak out. Like, what am I going to do now?
Yeah. So we're still really talking about cancer and using that as an example of how health can be lost, in quotes, from the body. So remember, we're talking about these microscopic cancers coming from 10,000 genetic mutations or mistakes that occur every single day that our body can fix. And if the cancers are still sticking around, our immune system will wipe it out. But it's an odds game, because eventually, some of these microscopic cancers can figure out how to escape your health defenses. Now, I've done research on this. So a microscopic cancer that starts forming can't get any bigger than about 2 to 3 millimeters in diameter. That's the size of that's about a grain of rice, okay? Can't get any bigger, no oxygen, no nutrients. It's stuck there, waiting for the immune system to just take it out. But over time, some of these cancers are able to hijack a blood supply, right? So it's kind of like they kick the cockpit door open and they take over the plane. And when they take over the blood supply, when we've studied this, the first blood vessel that actually grows up to, that's hijacked, that grows up to touch the tumor to deliver oxygen and nutrients, can make that microscopic cancer explode in size 16,000 times in size. That's how fast it'll grow once it's fed in 2 weeks. All right, so that's why angiogenesis, tumor angiogenesis, abnormal blood vessel growth that tumors hijack is such an important thing to prevent. And that's why diet, that's why medications, that's why lifestyle, whatever you can do to actually get in control of your own circulation so you can starve cancer by cutting off the blood supply, that is a very important thing to do.
That's really good. What do you think of the term turbo cancers itself? Like, is that just a term, or is that an actual phenomenon?
I have never heard of the term turbo cancer as a researcher. Seems like something that would be on a T-shirt or a website, turbocancer.com maybe. But I will tell you that, listen, cancers can be slow growing, medium growing, or fast growing, and different tumors grow at different speeds. We are now understanding that the approach to an individual, whether it's nutrition or medicine, including cancer therapy, really should be approached on a personalized, individualized sort of way. So, in the old days, we used to have these one-size-fits-all statements, all right? And what I say is that, every individual is going to have a slightly different circumstance. They're going to have their own legacy of how they grew up from childhood, the genetics they inherited from their parents, the activities and the behaviors, risky or not risky, preventative or not preventative, that they're undertaking every single day. The good news is that all the research that's on disease prevention shows it's never too late to be able to make a move, to alter your diet or lifestyle, to be able to make a difference on your own individual health.
That's key.
So that's very key, because a lot of people say, yeah, I've been smoking my whole life. I'm gonna die of lung cancer anyway, so I'm just gonna keep going. Nope. Actually, if you stop, okay, your body you're taking off a pressure on your health defense. Your body is very resilient. It's going to swing right back and start to counter some of the damage and fix it right up. Same thing if you've eaten unhealthy food, if you're a junk food connoisseur, and that's when you've been just plowing down junk food your whole life. You know what? If you were to alter your diet, start small and then go big, you'll actually catch up. Your body will be resilient. And I think that's what we don't often give enough credit for, is the resilience of our own body to bounce back to health.
Yeah. So, I mean, that in some ways you have to understand the defense systems. And so I think it makes sense to start with angiogenesis. Obviously, you're the CEO of the Angiogenesis Foundation, which is a leading nonprofit organization that targets the system to improve global health. And so you wrote in your first book, every single type of solid tumor, ranging from breast to prostate to lung to colon, must have angiogenesis to grow beyond a pinpoint size. Without angiogenesis, cancer cells also cannot spread. And so that felt extremely significant to me in understanding the system. And then even when you're talking about like the new therapies and stuff that we're targeting. So pretend that I'm, I don't know, a youth or a 5-year-old, like how would you explain to me what angiogenesis is and how it plays a role in cancer?
Yeah. Well, I mean, angiogenesis sounds like a complicated word, but it's actually pretty simple. Angio, blood vessel. Genesis, how our body grows it. So angiogenesis is just how our body grows our circulation. And it's really important for our health because every single organ in your body requires a blood supply. You need oxygen, so the air we breathe goes through our blood vessels to keep our organs alive. And all the food we eat, the nutrients get absorbed into our blood vessels, and our blood vessels are the highways and byways that deliver the nutrients to feed our cells and our organs. So basically, when your blood vessels are healthy, you got a shot to be healthy. When your blood vessels are not healthy, and you can't deliver oxygen and nutrients, the rest of your health starts to suffer. And so it's one of the common denominators of health that you must actually focus on. And that's why it's so important. It's not just for heart, it's for every organ that requires blood vessels. And what happens is that when you actually have problems in your circulation, you might have too many blood vessels. You might not have enough blood vessels, okay? What you want to aim for is just right, but if you have too many, that could actually lead to disease. For example, the most common cause of vision loss, blindness, in people over the age of 60 are due to blood vessels growing in the back of the eye. The eye is supposed to be crystal clear, right? You have to hold it up to the light. You can see right through it. That's why we can see the world. But if you have blood vessels growing in there and leaking, you're destroying the ability for light to get to the carpative nerves in the back of your eye that signal to your brain what you're actually seeing. And so angiogenesis-dependent diseases eye disease, cancer, arthritis, Alzheimer's, obesity, complications of diabetes. I mean, it's about 70 different diseases where you actually have either too many or too few blood vessels. Now, too few blood vessels actually is also equally devastating. You ever scrape your knee, right? Like you fall off a skateboard or a bike or something like that, right? You get a scab that grows over it. And if you're like me, or like most kids, sometimes a scab comes off too early. And what do you look at? You see this bright red bubbling stuff underneath it, under the bandage. That's angiogenesis. That's your body growing blood vessels to heal that area, to bring more oxygen, bring more nutrients, grow that healthy tissue back. It's like fertilizer going in there so you can actually grow more grass in a bald area in your lawn, okay, in your property. So the thing is that if you can't mount that response, your wounds aren't going to heal.
Yeah.
And that's a big problem. In fact, in the aging population, some people will know that older grandmas and grandpas in nursing homes, they can sometimes develop bed sores. And that's really just the weight of their body against the firmness of a mattress that causes a wound, or a rubbing, lack of blood supply, and then they don't heal. Well, guess what? That's a problem of not enough angiogenesis and having that pressure. And so you want to actually develop ways to spark more circulation to grow for healing. So this by the way, all the health defenses are the same way. Our body knows how to have just the right amount of defense so that we're healthy, not too much, not too few, but just the right amount. I call it the Goldilocks principle. The Goldilocks fairy tale, the three bears, they're looking for porridge, not too hot, not too cold. The seat can't be too hard or too soft, or the bed. And that's exactly what happens in our body. Our health is a result of these health defenses that are hardwired to be able to be just right. It knows what to do to be just right. You want to make sure you don't have too many or too few of any one of these defenses, but you want the zone of happiness and as long as we can. So if you want to live a long time, like longevity is a big deal these days. People are really excited by the prospects of living longer. But I'll tell you, you don't want to just live long, you want to live well.
Yeah.
If you want to live well,
Healthspan,
you need your angiogenesis, you need your health defenses to accompany you on your entire journey.
That's so good. Yeah. So the next one, relates to regeneration and stem cells. So can you tell me how that one works?
Okay. So listen, when I was in grade school, my teacher told me about what regeneration was. It said that starfish can regenerate an arm, a salamander can regenerate a leg, but unfortunately people can't regenerate, right? Well, that's not true anymore. We know that humans can regenerate. We do it slowly, and we do it from the inside out. True, we can't grow a new arm or leg, and we don't have a tail to grow, but I will tell you that we regenerate using stem cells. That's what starfish use, and salamanders as well. And these stem cells are tiny little regenerative cells that can turn into whatever they need to be turned into. That's why they're called stem, meaning that they're just at the stem of, they haven't figured out what they want to be yet. Maybe a liver, maybe a tooth, maybe a hair follicle, whatever it is they want to be. And that stemness is really important. In fact, we were all formed from stem cells when we were still in our mom's womb. So when your dad's sperm met your mom's egg, okay, and you were just a ball of cells forming, you didn't have a face, you didn't have an organ, you didn't have any organs, no kidney, no liver, no lips, no ear. The bottom line is you're just stem cells. Those cells, which were stem cells, had to figure out what they were going to become to form the future you. Now, you had 9 months to do that, right? To have all these stem cells form, perfectly. Your fingernails, your toenails, every aspect of your body. And at 9 months, you're born. And guess what? Your Mother Nature made sure that we had more than enough stem cells to form everything. So when you're born, you've got some extra stem cells that wind up getting packed away in our body after we're born, and they live in our bone marrow. So think about these extra stem cells. Like, you ever paint a room like a project?
Yeah.
Like a home project, right? So what do? You got to go to the paint store and buy, how many cans of paint you're going to buy? Well, you don't want to have too little. So you're going to buy maybe an extra can or two, because man, would it suck for you to paint and you're done except for one little section, and now you're out, right? Mother Nature did the same thing with stem cell. We got 70 million extra stem cells overage, so that when we're born, that 70 million still in our body, they just get packed away. It's kind of like extra socks in a drawer. They get put together, matched up, folded up, put into the drawers. Now the stem cell drawers in our body, when we're born, is our bone marrow and our skin and our body fat. And literally, these stem cells just get packed away. It's like a beehive. They just get popped away. And then later on throughout life, when we need to regenerate, when we need to repair something, you might not feel it, the need for repair. Might be your heart, might be your kidney, might be your lung, all right? The signals inside your body will call out your stem cells. This is part of our health defenses. Your stem cell system will call out the stem cells like bees coming out of a hive, and they will circulate in your bloodstream. They'll find just the place they need to actually fix, repair, and regenerate, and they will home in there, fix it, and all the other stem cells will just go back to base. Okay, it's really quite remarkable. Now, I'm somebody who's worked, I've been involved with cancer research. I've helped to develop cancer therapies. I've also been involved with developing stem cell therapies. It's still in development. I'm not talking about stem cell treatments you'd get at a strip mall to inject in your knee or your elbow. To me, that's not ready for prime time. The stuff I've been involved with are really repairing spinal cords or trying to grow new heart tissue after a heart attack or even grow new brain after a stroke. I mean, the potential is huge. Yeah. Or even to regenerate your eyes. If you have a problem and you go blind, like how amazing would that be to regenerate your optic nerve, right? So we're on the cusp of being able to do this. It's very early days, but we're beginning to see some early progress in clinical trials. But you know what? Mother Nature beat us to the punch. We already do that inside our bodies, and the foods that we eat can light up our stem cells and make more of them come out to do their job.
You wrote that stem cells are they're vulnerable to a lot of outside factors. What did you really mean by that?
Okay, so these stem cells, right? Think about these little bees that are flying around. They're called out to a mission. Okay, like fighter jets coming out. Yeah. Okay, and they're looking for where they need to repair. Well, look, you don't want to be shooting these fighter jets out of the sky, right? So, and you don't want to damage them, right? Bird strike, kind of thing. So, what are the things that can damage our stem cells when they're trying to do their job? They're on their way to repair or regenerate something inside us that we don't even feel, we don't know about, but really important. Well, alcohol. You have a lot of alcohol in your bloodstream, that stuns our stem cells. A lot of fat. If you have a lot of cholesterol racing around in your bloodstream, all right, high fat will stun your stem cells, slow it down. High blood sugar, hyperglycemia, that's a term that we use when we refer to, like a lot of people talk about glucose spikes and glucose crashes. As a scientist and as a clinician, I tend to focus on what's the average amount of blood sugar that's running around. And if the average amount is really high, the water line is high, all right? It's kind of like the tide zone is high, all right? That's actually a danger because hyperglycemia, high blood sugars, stun your stem cells. High salt will also do it as well, all right? Fortunately, your body can actually titrate the amount of sodium or salt that's in our bloodstream. But again, you can kind of see how this ties to lifestyle factors, diet. These things can actually, you want to keep your stem cells in good shape.
Yeah, that's really good. So angiogenesis, regeneration, stem cells. I mean, the third one we alluded to earlier, which was microbiome. What absolutely blew my mind was, so you wrote in 2000, there were only 74 articles published on the microbiome. And in 2017, there was 9,600 research articles that emerged. I mean, that increases us mind-blowing in terms of underscoring the importance of understanding the microbiome, the role it plays with health. I mean, that's just such a massive increase in only 17 years. So can you talk about the role of the microbiome and as a health defense system in the body?
Yeah. So basically the healthy gut bacteria that we talked about earlier that live primarily in our gut, but they're in other parts of the body as well. Anywhere you have an opening in your body, you actually have a healthy gut colony. All right. These bacteria in our gut, they serve a role. For example, when we feed our gut bacteria dietary fiber or polyphenols from our foods, that's the food they want. Like our gut bacteria is like our pet. Do you have a pet dog or a cat or a bird?
Yeah.
Okay.
Golden retriever. Yeah.
Okay, you got a retriever. All right. So look, you wouldn't think you don't have to think twice about feeding your dog. You just do it as a matter of instinct, right? You're going to take care of your golden. All right. Guess what? We actually do the same thing to our gut microbiome when we're eating foods. We're feeding ourselves, our human body, our human cells. We're also feeding our gut bacteria. Now, you probably would be appalled if somebody who was dog sitting fed your golden like trash, something horrible, right? But you know what? When we actually eat junk food, ultra processed food, additives, all right, we're actually feeding our gut microbiome, our pets, something really bad. So when we damage our gut microbiome, the things that they normally do to protect our health suffer. One of the things they do, normally lowers inflammation. So if you damage your gut microbiome, inflammation rises. Okay, it's like a flood. It just kind of like wells up and spills over. Now you got inflammation everywhere. You want to talk about one force that can trigger cancers to grow fast? That turbocharging you were talking about, it's going to be inflammation. So you got to keep your gut really, really calm in terms of let your gut do the work for us. The other thing that our gut does is it primes our immune system. 70% of our immune system actually lives inside the walls of our gut. All right, so our gut bacteria talks to our immune system. And listen, after 2020, everybody knows how important the immune system actually is. But our gut bacteria talks through the wall of the gut to our immune system. So people go, well, I can't picture that. All right, picture this: you're a freshman in college, you're in a college dorm, you got a roommate, you're in a room, you got a roommate next door, and you got a really thin wall. What do you guys do? When you're a freshman, you yell through the wall at your roommate, "Hey, what do you want for pizza? What do you want on your pizza?" And they can yell back at you. And this is exactly how the gut bacteria and immune system talk to each other through the wall of your gut. And so when your gut is actually healthy, well-fed with polyphenols, dietary fiber, it will talk nicely to your immune system and tell your immune system what to do. Strong immune system, you can actually fight invaders from the outside of the body as well as invaders from the inside of the body, i.e. cancer cells. Those drug dealers sitting on the street corner in a suburban neighborhood, right? That's the microscopic cancer. You want your immune system to be really strong to be able to do that. So this is actually one of the importance of the gut microbiome. Now, I'll tell you, the gut microbiome also helps to smooth out our metabolism. It helps us heal well, makes our cells more sensitive to insulin, so we can actually regulate our blood glucose better. And our gut bacteria, by the way, text messages our brain. So one of the biggest nerves in our brain, called the vagus nerve, comes pounding out of the brain and goes right down to our gut, and it fans out. The nerves fan out like the tail of a horse. Okay, like the end tail of a horse in a wind. So lots of little fibers. That's what the vagus nerve does. And guess what? The gut bacteria send SMS signals up and down that channel, the communication channel, back to the brain. All right. Now, recently, this is like a stunning new discovery. I mean, I'm talking about within the last 6 months, they have discovered that the brain has its own microbiome.
Wow.
That's like stunning to think about. And about 20% of the bacteria in your brain, healthy bacteria in the brain, your brain isn't infected, it's healthy. 20% of the brain bacteria are the ones that are also found in the gut. So clearly, these are relatives that are actually working together.
Yeah. Yeah. And then, a lot of people don't realize that, even some over-the-counter medications and stuff, there's so many things that are microbiome like modifiers that are affecting you. And one of the downsides of taking something like a antacid for a really long period of time is like the way that that's modifying your microbiome. And then, so a lot of the intersection between some of the pharma drugs that are aimed at helping you with a specific issue, then I'll end up altering like the microbiome. And so that's like another thing that people that you need to be
Sure.
aware of?
I'll tell you, there was a stunning research paper that was published in the journal Nature that looked at the connection between antibiotics, which are designed to kill bacteria, and breast cancer survival. Okay. And they found in a large population of women that the more rounds of antibiotics they got, the worse their survival is. Now, remember I told you the gut microbiome is actually responsible for lowering inflammation and boosting your immune system. And so, I think it was sort of like from no exposure to antibiotics, you had, reasonable survival. Then you went to like 8 different types of antibiotics over time. The survival just started to chunk down, you really dropped it. That said, let's not forget that when their gut bacteria have overgrowth of harmful bacteria, one of them is called C. difficile. Okay, that can actually kill you if you have too many bad bugs growing. So sometimes you want to give it antibiotic that can be life-saving to reset. You want to weed out some of the bad guys, and sometimes you need an antibiotic for that as well.
Yeah.
So again, these are this is why
this is like we were talking about at the beginning, the nuance of
it's the ecosystem.
Yeah.
It's it's the functional aspect of it. Everyone who thinks about health wants the black and white, the on and off switch, the magic bullet. But I would say, our health is more like conducting a symphony. You got a lot of violins, you got drums, you got trombones, you got, cellos. You have to get everything to work the right way. And guess what? Who would have thunk that you could actually direct Beethoven's symphony? It's beautiful, but it does require skill at lots of different levels.
No, I think that's a beautiful analogy in terms of having the symphony specifically, because I feel like that, people they really do want a black and white answer to a lot of these things. And there's so much gray. So I think, we talked about microbiome, angiogenesis, regeneration, stem cells. I think, you alluded to this, but a lot of people are familiar with the immune system now as a defense system. It's probably one that they're most familiar, have heard about. The last one is, DNA protection, which you wrote that DNA damage is found in every type of cancer. And so what do you feel like people need to understand about this one?
All right. So DNA, most people will know now that DNA is our genetic code. We inherit our code from our parents, right? Mom and dad. And people screen for genetic mutations for different kinds of diseases. If you're an older woman and you're pregnant, you might be screened as a high-risk pregnancy to see if there's any DNA problems that you find in the fetus by, looking under the microscope or doing an analysis of amniotic fluid. So this is the kind of stuff that people generally encounter this side of DNA. But our DNA is part of our health defense system. And the reason is, first of all, our DNA has to work perfectly to be able to produce all the proteins we need to survive and function. But our DNA gets damaged really easily, okay? Like environmental things, not just, deliberate toxins, or maybe accidental toxins, not just the chemicals underneath your sink for the cleaning agents, all right? But think about this. DNA is so delicate that if you go out to tan and you get a sunburn, you've damaged DNA big time, which is why repeated sunburn increases the risk of skin cancer like melanoma, okay? But do you know that happens at a lower level in lots of different circumstances? If you're driving down a freeway every day and you're stuck in traffic and sunshine is coming in on one side of the window and hitting one side of your face and one of your arms, all right? You're mutating the DNA in your skin. How come you don't get skin cancer? Just from being stuck in traffic? Because your body fixes its DNA. DNA repairs itself. I always tell people and by the way, flying in airplanes, get a lot, it's like getting a chest x-ray. If you fly from New York to Los Angeles, you get radiation and that damages right through the fuselage of an airplane. Now, but the body can fix itself. So you're not really at risk for the most part. Now, the other thing is that I always tell people, just to give people an example of how remarkable our body is at protecting our DNA. Think about this. If you are driving a car and you have a gas car as opposed to an electric vehicle, and you got to pull up to the filling station and you're pumping gas into your car, I always ask people, do you stand upwind or downwind of the pump? People look at me like, I don't know why you're even asking that question. Why would you even think about that? What I say is if you're smelling the fumes of the gasoline, you're standing downwind. And that means that those fumes from the petroleum are actually going into your lungs and causing mutations of your DNA. When I fill up the gas, I sense where the wind is coming from and I go upwind.
Yeah.
I don't want to be breathing it. But you know what? We don't get lung cancer filling up our cars. Okay. Why? Because our body's DNA protection system can repair any damage. Now, there's another really amazing aspect of our health defense with DNA, which is that at the end of our 3-foot long strand of DNA that's wound up and packed into a single cell, all right? That's like a meter long of DNA. You've got at the very ends of them these little protective caps. What am I talking about? Well, if you think about your DNA like a shoelace, right? Think about like a shoelace you got to tie up. What do you have when you get a brand new pair of shoes? You got shoelaces that have these little plastic caplets at the end of them, right? And they protect a shoelace from damage. That's what our telomeres, it's called a telomere at the end of our DNA, does to protect our DNA from damage. Now, what happens with your shoelace if you wind up having the plastic caps, the tips kind of crack and fall off? You got a problem, right? So what happens is that the shoelace frays. Now you're trying to thread it back in, and it won't kind of go back in. It's a real problem, and that's what happens as we age. Our protective caps at the end of our DNA starts to shrink down. All right, and this is aging. All right, our telomeres, our protective caps shrink down, and so one of the things that we know is that healthy diet and lifestyle, Mediterranean diet, omega-3s, polyphenols, exercise, good sleep, drinking healthy beverages like coffee and tea and water will actually slow down the rate of the burn down of your protective caps on your DNA. So this is a way to regulate the speed of cellular aging. It's all in our hands. Like, we are all empowered. Everything we talked about, from angiogenesis, stem cells, gut microbiome, DNA, immunity, we are empowered to make decisions every single day that can actually strengthen these health defenses.
What I found interesting is, like, when you look at these 5 things as a collective unit, like, do they all, because I noticed, like, in every single place you were saying, like, specifically with cancer, like, they basically all are going wrong, or most of them are going wrong. And so is that actually like what's happening? Is that like one of them starts breaking and then all of them go haywire, or how would it be the case that you said DNA damage is found in every single cancer, and then you also said that like angiogenesis is also found in every single cancer? So like, are all these defense systems?
Yeah, well, think about it. Think about this, right? We got redundant backup systems to protect us. The DNA, just by copying and pasting ourselves, we're going to have some mistakes. Now you add a little bit of the sunburn, you add a little alcohol, you're breathing secondhand smoke. That's why you definitely don't want to be vaping. That's terrible, like for your DNA. All right. Now you get a little microscopic tumor, maybe more than one microscopic tumor, all right, around. Guess what? Your immune system is strong. You take your and it's going to wipe it out, but now you damage your immune system. Oops, it's not. Now the cop's driving by, doesn't see the drug dealer sitting on the corner. Now you put some inflammation in, and now you spark blood vessels to start growing towards that cancer. All right, you see what I'm saying? Like it's sort of like it is a domino effect, a cascade of things that happen that break down. There's usually, like they say, like a airplane crash. Like when an airplane crashes, it's very rarely one thing that causes the plane crash. Yeah. It's a series of problems and then errors, mistakes that are made one after another that winds up leading to the thing hitting the ground. And so I think the same thing is for our health. When we're born, we are hardwired to be healthy. The moment you're born, these 5 health defense systems, angiogenesis, stem cells, microbiome, DNA, your immune system are firing on all cylinders. Yeah. And they're going to try to keep us as healthy as possible for as long as possible. And by the way, if one of them gets damaged, if you actually do the right moves, take away the damage, add foods that can, and do lifestyle maneuvers that can actually help that system, it's resilient. It'll bounce right back. It's our hardwiring. It's like the hardwiring of a laptop. All right, out of the box, we come out of our moms. It's perfect. It's working the way it's supposed to work, right? You plug it in, you charge it up, makes the sound, and it's going to work and word process and you play games and do whatever you're doing very normally. But over time, your operating system can get damaged. You spill some water, you drop the computer, it gets too hot, right? Dust builds up, you download some stuff that winds up, having some viruses. You don't clean, you don't do the hygiene, like digital hygiene on your computer. So this is what we need to do. When you talk about functional medicine, functional health, it's really about doing that kind of maintenance, thoughtful, mindful maintenance of our body in all these different components.
Yeah.
And you don't wait until you get sick. That's the difference. Going right back to the beginning where you're saying like the regular, conventional physician. Listen, I'm conventionally trained doctor, even though I do really advanced stuff. I can tell you that, I was cookie cut from the same bolt of cloth that all doctors are. And I will tell you that most doctors are not trained to think in an integrative, holistic fashion. Yeah. And that's really what I think we're learning. Doctors are learning about it now too, but partly because people like the ones that are listening to this podcast or watching this video, like they are demanding their doctors to do more, learn more. And I think that's a good thing when the consumer, when the patient advocates for themselves. And by the way, all those remarkable cancer patients I told you from stage 4 to stage 0, okay, the reason they got there is because they advocated for themselves. So anybody listening to this, I encourage you to work with your doctor. And if you don't get along with your doctor, get another doctor. There's no problem. All right. Like it's up to you. It's you're in charge, but you got to advocate for yourself. You got to actually do your own research. And if you're not getting what you know you should be getting, you need to advocate for yourself to get it.
Yeah. I love what you're saying. I feel like there's so many aspects of the conventional medicine system that are such a felt experience for the average person. Like you don't even have to be listening to this podcast to know that like how certain things work in terms of like advocating for yourself. Like I've had kind of mysterious gut issues for like 3 years now. And I was working with a functional medicine doctor and, thought it was originally SIBO. I did a stool test and it seems like I have overgrowth of some bacteria, but I tested negative for SIBO. So anyway, she was talking about potentially interfacing with like a GI doctor and like getting them involved in the whole entire picture. And then so I went to a GI doctor, a conventional GI doctor. I gave her this whole kind of timeline of like all these different tests I've done and like this and that and the other thing. And then kind of like at the end of basically 10, 15 minutes speaking, she's like, "Oh, well, what do you want me to do for you? Like, I'll give you a antacid to like." Because the main symptoms like belching, and she didn't. It wasn't like let's investigate this or let's do this. It's like it's a lot of the training seems to be let me just give you a pill or a procedure and have a brief 15-minute visit with you, rather than really trying to figure out like what it is going on here. And so I feel like you do need to really advocate for yourself or look elsewhere. Problem is like a lot of the most of the doctors are conventional, and functional medicine obviously is a burgeoning field, but like it's still not the predominant thing that's happening in the medical system. And
well, what I say is that if you look in the future, the way that we're going to actually preserve health, keep our communities, our countries healthiest, is not going to be just waiting for disease to occur.
100%.
The way to actually have a safe highway is not waiting until the 20 car pileup occurs. You got to actually do things to prevent that from actually happening. And I think functional medicine, which seems like kind of a privilege, unusual thing to reach for now, I think in 25 years, everyone's going to be practicing functional medicine, integrative medicine. And if you don't practice functional medicine and you only practice sort of pharmaceutical medicine, black and white, XY axis medicine, on or off medicine, you're actually going to be doing the alternative medicine approach.
That'd be a nice world to live in. So let's get into like the meat of conversation. talk about prevention happening in the first place. Start with that. Because that's probably where a lot of people are right now listening to this. And so you've done a lot of work studying how food specifically can reduce the risk of chronic disease. And so like, as we get in that topic, we've talked about nuance a lot. What's the proper framing here? So like, are some people might come away with like, oh, if I eat this or drink that, I'm definitely not going to get cancer type of thing. Like, how would you kind of preface that and frame the studies around these things?
Well, as it relates to prevention, I think that, if you realize that we all start off with no disease. Most of us start off with no problems. And then our responsibility is maintenance. So do good for your body regularly is kind of like you're going to take care of your car, change the oil, check the tire pressure, fill up the windshield fluid, do all the things that you need to do, get it inspected every year in order to be able to stay as healthy as possible. And I actually think that, sure, there are some people who are super hardcore about this and they get to be biohackers and they want to check their levels and their numbers every hour. Listen, that's okay if that's who you are. I think most people just want to go about their lives. They enjoy other things. They don't want to have to think all the time about their health. That's probably one of the biggest obstacles, I would say, to prevention is this idea, which is a false idea, a wrong idea, that, you've got to be obsessed with your health if you're going to prevent disease. I actually, for me, because I study food as medicine, my mantra is you can love your food in order to love your health. If you actually take a look at the foods that are healthy for you and realize, you know what, I love these foods. So I actually create a whole list of foods in my books. And I tell people, if you're reading my book and you want to, I've done all the heavy lifting. I've already identified 200, 300 healthy foods, all right? You don't have to think any more than trust me that I've actually done the background work to look at these foods that are going to be healthy for you. Take a Sharpie or a highlighter and circle the ones that you already love, all right? Because now you already know you love some healthy foods. Then integrate those into your life, all right? And they're going to help you be healthy. So you don't have to, most people don't realize you don't have to stretch that far. You don't have to hire a trainer. You don't have to get a special gym membership. You don't even have to subscribe to supplements every single week or every month. I think we all start with a clean slate, maintain ourselves as much as possible. Basic things, diet, pick the foods that are already known to be healthy, and eat those, all right? Stay away from the ones that are not healthy. And then some other basic things of prevention, I would say, are getting enough sleep, 8 hours, 7 to 9 hours of sleep. Let's call it 8. 8 hours of sleep, cleans your brain. It's kind of like a cleanse of your brain. It's a recharge, helps your stem cells when you're sleeping as well, reboots your immune system, your gut microbiome resets when you're sleeping, your metabolism actually revs up when you're sleeping in a very good, healthy way. Sleep, stay physically active. We like to use the word exercise, but some people are put off by that word.
Yeah.
I'm just saying, go out for a walk after dinner for 30 minutes every day. That's a great start.
Walking.
Walking is actually good.
Which was like built into ancient life. Everyone walked everywhere, so you were doing that all the time.
Right, exactly. But I'm just saying that like that whole, there's a lot of obstacles that make people think prevention is hard. But listen, definitely do, high intensity training if you can. But you know what? If you're a couch potato and you want to get healthier, just go for a walk, all right? That's the easy thing. And by the way, one of the things about diet I want to bring up is, and this is actually a really important from a prevention perspective in the United States, especially, which is when you eat, even if you're eating good, healthy food, I don't care if you're a vegan, a vegetarian, gluten-free, whatever you are, or you only organic foods, you don't want to eat too much. Overconsumption of food damages your health defenses, every single one of them, all right? And overconsumption is really what a lot of people knee-jerk do when they're actually there in front of a plate of food. Look, when we were kids, our teachers told us, or maybe our moms told us, clean plate club. Don't leave any food in the plate. There's people starving in, you name the country. As it turns out, you don't need to clean the plate. You just need to eat slowly. Your body, if you listen to your body, you'll know when you're satisfied. Don't eat until you're stuffed. Eat until you're satisfied. That's another little trick. There's the Japanese saying called hara hachi banmi. That means stop when you're 80% full.
Yeah.
Don't stuff yourself.
I've heard that before, yeah.
Go just up. And, you're like, well, I don't know. What's 80%? How do I know if I'm not at 60% or 90%? If you eat slowly and learn to listen to your body, relate to your body, what that means is that when you're eating, don't be scrolling on a phone, be distracted. And the other thing that can help is take smaller portions, even of healthy food, all right, and eat more slowly. And all of these things, these little steps, and we can go deeper and deeper and deeper into what they can do. But these are the little steps. Manage stress. You lower stress. You protect your health defenses. These are the things: sleep, movement, diet. They all actually gang up to be able to help us do that daily maintenance, so that we can actually make our entire journey in the healthiest possible way.
It's a symphony you're talking about.
The symphony.
So, drilling into the diet portion of that, what to add, what to avoid. I want to talk about the avoid, and like a big one up front is alcohol, especially because it's so relevant in the news lately. But I think there's a lot of confusion around the topic. Alcohol, and number two, alcohol is like consumed by like most cultures, like in some sort of like social fashion. So the new report from the U.S. Surgeon General kind of added to that confusion in some ways. And yet, when I read your book, you talked about the health defense systems, and you said that alcohol was cancer causing. And then in other parts, you had listed wine and beer as protective against disease. And so first, have you seen the report? And second, like, how would you navigate all the confusion for people who are asking, does alcohol cause cancer?
Sure. Okay. So first, before we dive into the science, let me just say alcohol has been part of human society ever since we began growing grains. Go back 10,000 years. Okay. Whether it's barley, whether it's honey, whether it's, or whatever it is, people have been making alcohol, and it's been part of our human tradition. Alcohol is used to celebrate weddings, funerals, birthdays, holidays, major events, okay, significant major events. And so, my own personal view, and, even though I'm a scientist and a doctor, is that, let's not get too bent out of shape about alcohol. It is part of our humanity. It's very important when you're thinking about the big picture, the functionality, the functional health part of it. We're all human, Like, you're going to get together for a wedding, have some champagne. You're going to actually have a holiday, bar mitzvah, whatever it is you're going to do to celebrate something. I think it's okay. The key is not to overconsume alcohol. And here's the reason why. Alcohol, which is ethanol, ETAOH is really the chemical symbols for it. Okay, that ethanol is toxic to every cell in your body. It's toxic to your brain, toxic to your heart, toxic to your nerves, toxic to your liver. And in fact, our body has developed some pretty sophisticated ways to disperse the toxicity of the alcohol. And our liver can burn it down, burn it off, right? And we know we burn it off, and we even breathe it out, which is what, the breathalyzer is all about. If you get pulled over on the side of the road. So our body can actually take care of it. If you overconsume, once, you're going to feel it, but then people get used to it. And if you overconsume over a long period of time, that's when the toxicity of the alcohol will really do a number on you, like really, really damage you. So I think that, again, in the interest of not making this black or white, alcohol is is either an angel or the devil. Let's just say alcohol is part of humanity. I think it's perfectly fine to use it in moderation to, at events where you're commemorating, celebrating something. But always know that alcohol in any form, the ethanol, is actually toxic. So the more you have, the more toxins you're actually consuming, even though it's part of our culture. Now, what about this whole issue about beer and red wine? Well, actually, it turns out that the beneficial aspects of beer and red wine have nothing to do with the alcohol itself. It has to do with what makes red wine red, which is the polyphenols that come from the fermentation. So if you removed all the alcohol and just had a glass of non-alcohol, de-alcoholized red wine, you'd get the benefits. And beer, similarly, it's the hops in the beer, the barley, okay, that actually wind up having the benefits, the polyphenols that actually come off of it. The xanthohumols are actually the chemicals in beer. Remove all the alcohol, you'll get the benefit. And once you have the alcohol back, listen, you're going to get a buzz from it. All right, you're going to get all the things that alcohol is supposed to do, including the toxic aspect of it. So to me, it's really, this is kind of a judgment thing. I mean, look, it's like anything else that we do in life. You know, exercise good judgment. You're driving a car on the road, follow the speed limit. Dangerous to speed, the speed kills. Every now and then you're late for a meeting, you need to get in the fast lane and you need to zip ahead. Use your best judgment. That's kind of how I approach the whole alcohol thing. And by the way, the Surgeon General's report on, making alcohol, cancer causing, that's not news. I mean, we've known that for 50 years at least. All right. So that's putting into policy from a government perspective. That's that's something that every medical doctor and almost every life scientist has known for the last 5 decades, and just making it part of public health.
What do you make of like the report saying that like moderation didn't matter? Because that was the one thing that stuck out to me that really surprised me, and it was very like accentuated on the report.
Well, I think that words matter, and I think that probably the policymakers drafting that language realize if they say alcohol can cause cancer, but moderation is okay, would just give people an out to be able to drink more. So they sort of took a hard line approach to it, saying that moderation doesn't really matter. I mean, look, moderation does matter. I mean, for sure, it does. Smoking 1 cigarette is different than smoking 100 cigarettes. All right. I mean, that's obviously true. So I think that if you're going to, listen, I have many friends and families and patients who drink alcohol as part of social custom. And when they ever ask me for health advice, which, a lot of people ask me for health advice, and they always bring up maybe a little tenuously, they're a little bit afraid of what I'm going to say about alcohol. Like they don't want me to smack them in the face about alcohol. I always tell them, like, what about my wine? Do you mean I can't have any wine? I'm like, no, you know what? Listen, if there's something that's important for you enough to enjoy a glass of wine, life's for the living. You got to enjoy yourself a little bit. Just recognize the alcohol in the wine isn't good for you. It's a toxin. And the more you drink, the more toxic it's going to be. So exercise judgment, be moderate, take care of yourself. And I'm not your daddy, you're going to make your own decisions just like anything else.
Yeah, no, I think that's really good. I mean, would you like, I don't know, Andrew Huberman put like he had this whole talk on alcohol that was like, I don't know, has like 5 million views now. And he was like, 2 drinks a week, that's like the max or something like that. Is there, when you talked about moderation, like for you, is there like a number where it's like, if you're exceeding this much alcohol content in a week, it's probably any benefit that you're getting from the wine or the beer independent of the alcohol is just going to go out the window.
I think that's again, this individual, it's an individual situation because depending on your liver, if you have certain enzymes that detoxify the alcohol faster, if you're a fast acetylator or a slow acetylator, these are terms that refer to how well your liver detoxifies things like alcohol. It's going to make a big difference if you're drinking with food, no food, whether you're having liquor, whether you're having wine, I think that again, I can't give one number that applies to everyone. But I would say, there's many countries, including the Mediterranean countries, where, supposedly the healthiest diets in the world, traditional ones, they do drink wine. They drink wine with meals, with food. I think it still does boil down to being reasonable about what your intake actually is.
Yeah, that's good. Yeah, I mean, I feel like a lot of people, what they're actually weighing is the social cost of not ever partaking in it, even if it's like, and that I feel like affects your longevity in another way, in the sense of like at social gatherings or whatnot. If I'm just like, and I understand with people that are alcoholics, they completely avoid, but if people are just like completely avoiding going to social gatherings or whatnot, I'm not going to drink. What is the social benefit of even going out? Oh, I'm going to go out to a wine bar and like have a good time, whatever.
Well, that's what I'm saying, is that really it's a social custom, part of our humanity. We talk about health. We sometimes just forget about the humanity of things. We gotta live. We gotta be human. And for me, even though I'm like a hardcore researcher and a doctor, and I focus on food as medicine and health and prevention, I think it's okay to be human.
Yeah.
And we have to address that part of our makeup as well, because if you spend all your time thinking about restriction, that's also unhealthy.
Yeah, no, I agree. So in terms of, other things on the avoid list, I think you actually include this in a recent video you had. I was kind of blown away by the whole processed meats thing. And, the World Health Organization classified processed meats as a class 1 carcinogen, which is kind of significant because tobacco was also listed as like a class 1 carcinogen. Can you explain, so what falls under the category of processed meats and why are they harmful to their health?
Okay. Yeah. So let's first, this is kind of a loaded topic, so to speak, because, there are people that follow a carnivore diet. There's people that follow a vegan diet. And this is where food almost is like a religion. My God is better than your God. But in point of fact, humans evolved over our entire history to really be able to eat different types of foods. And some of the more interesting longevity studies, actually, for people who are super agers, who live to 105, 110, they're omnivores. They're not vegans. Okay, they eat a little bit of everything. They just don't eat too much. And so I wanted to set that out, before we dive into the meat thing, because I think it's important to then isolate this idea, like, okay, what is it about meat and processed meats that could be potentially harmful? Well, regular meat, whether you're talking about beef, pork, chicken, duck, whatever, and I suppose an animal protein like fish or shellfish, it's a source of protein, and you get lots of minerals and other micronutrients that are actually part of an important balanced diet. Now, you can definitely nix meat of any sort and get plenty of protein and get most of your micronutrients from plant-based sources as well. So again, I'm right down the middle of the aisle here, which is, it's a matter of personal choice. Don't eat too much meat, because red meat in particular has a lot of saturated fat. And by the way, how you prepare your meat also matters. I'm going to get to processed meat in a second. I know you're waiting for that.
No, yeah.
But let's talk about like just regular red meat. All right. If you make a stew versus put something on a grill that you haven't cleaned and it's got all these carcinogens that are coming out of the smoke. All right. If you deep fry your chicken fried steak, you change something you take something that may not be that great for you, and then you turn it into something that's really not that good for you. Okay. You eat once in a while, not a big deal. You eat you have a lifetime habit of eating this way, it's going to add up. Now, what about processed meats? Because look, we all grew up, going to the carnival, the state fair, whatever it is, ball games, getting hot dogs and, that kind of thing, the sausage. And I can tell you that these processed meats are not fresh kill like you would have with a T-bone, steak, right? You're talking about meat that was taken off, ground up, mixed with other additives, preservatives, chemicals, flavorings. Some of those flavorings are artificial as well. I did not know this until I really looked into this red dye number 3 thing. Hot dogs are often colored with red dye number 3. Like hot dogs don't come out of the beef, out of the pig, or the beef or the cow
Looking that way,
looking
yeah.
red. Okay, I mean this is food coloring. So just think about that. Now you put into a casing, all right, and then think about that, which is then a processed meat. You've changed it from its native form. Now let's take a look at some of the other types of meats like pepperoni. Okay. Now you're actually adding all kinds of spices. Now you're throwing them into like baths with preservatives in them. All right. That's why the pepperoni, you look in the store, like the skin is wrinkled. You ever go into a bathtub too long? Your skin gets wrinkled. That's what happens. These pepperoni sticks are sitting in these like baths for a long time. Look, clearly you have changed the original source of the food into something else. That's what processed meat is. Is it the nitrates? Is it the artificial additives, the BHT? Is it the, we don't really know. Again, we're always searching for that one smoking gun, but it's probably a multiplier of these things and how the food is cooked and what the food is eaten with. If you're somebody that eats hot dogs all day long, okay, you're probably not eating a lot of salad. You're probably not eating a lot of vegetables. So it could be not just something that you're eating, but it could be ganging up with something you're not eating at the same time. And this is why, I think it's really important to be fair and balanced and take a kind of a balanced view when you're looking at this. But that said, all the population studies, so we're talking about looking at millions of people, have shown worldwide that eating a high amount of processed meats, sausages, hot dogs, all that kind of stuff, sandwich meats, like the lunch meats that we used to get when we were kids, that our moms used to make for us, or you get at the lunch lady, that stuff is not good. It's not good for you. It's just not a good source of nutrition, okay? And it actually has additives, and it's a class 1 carcinogen. And it's just something that really we need to be aware of and do less of. Cut down or cut out is what I say.
Yeah. I mean, it really was one of the surprising things for me, even when I watched the original video. I mean, because people were sitting here and being like, hot dogs cause cancer, or processed meats cause cancer. And I think when you really break it down the way you were just talking about, with all the preservatives that are added to it and the way that the meat is cured and it's just such a modification from I'm just taking a piece of pork and eating it like a slab of pork right from the animal. There's just so much modification that's going on with it.
Yeah. Now think about it. Go to the deli, right? In the grocery store, and the deli counter, and they've got these cylindrical tubes of meat, like bologna, all right, salami, and you're going to slice it up. I guarantee you the animal doesn't come like that, right? I mean, think about it. There's no part of an animal that is a cylinder like that. It doesn't. And yet that actually is how the factories have manipulated the food. Do you know why, how those kind of processed meats are held together? Have you ever heard of meat glue? Mm-mm. All right. Early part of the 20th century, like the mid 1900s, the military wanted to figure out how to actually make meat scraps hold together better. So they figured out a chemical that could actually glue meat together. All right. And once they invented that, it got picked up by the processed food industry to say, oh, you know what? We can take scraps of meat, we can pulverize it into little tiny pieces and just pour meat glue in there, and we can shape it any way we want. That's how those cylinders come about.
Oh my gosh. I had no idea. That's like a new thing I'm learning today. That's crazy. The last thing I want to get to before we talk about things that we want to add in, that people probably on top of people's mind, is sugar. So sugar and cancer, what is the latest research to talk about that?
Yeah. Okay. Again, a loaded topic, and as you could probably tell from our conversation, I refrain from going to an extreme, and I try not to demonize any food. So I'll just start right there. Listen, sugar is something our body needs in order to live. We cannot live without sugar. We have to eat sugar from some form. Our body needs it. Our brain is super avid for sugar. If you want to have sharp cognition, you need to have sugar, all right? Doesn't mean you need to have added sugar like cane sugar or high fructose corn syrup, but we need to get some kind of carbs that are converted in our body into sugar. So sugar itself is not evil. Sugar is necessary, all right? But where sugar actually becomes a problem is when we have too much of it. So what's an example of having too much of it? Well, soda. A typical 12-ounce can of soda has about 9 teaspoons of cane sugar. So you came to my house on a hot day, and the first thing I do is offer you a drink of soda, but I don't give you the soda. I just give you an empty glass, and I put 9 teaspoons of sugar and say, here you go, Matthew, here, drink that. All right, you're going to say, no way, man, that's disgusting. All right, but yet that's what is dissolved in a can of soda. And when they say empty calories, that means that, hey, in that can of soda, there's nothing else, just that sugar. So you slug it down. And hey, listen, we all have dreamed of slaking our thirst on a super hot day with one of those sodas that, we grew up with, right? I mean, that's natural. Again, back to our humanity. But I can tell you it's not good for us because we're drinking a huge amount of sugar. You do it rarely, you'll survive. Guarantee you that you will. All right. But think about the people who regularly drink a lot of soda. I knew when I was in medical school, there were some classmates that were drinking like 2 6-packs of soda a day.
Oh my gosh.
All right. And think about it. Just do the math of how much added sugar that is. So that kind of sugar is different because it's added sugar, extra sugar, than sugar in a piece of fruit. What's a really sweet fruit? How about a mango? All right. Mango is pretty sweet, a ripe one. I love mango. All right. But a mango also has dietary fiber. It's also got carotenoids. It's got vitamin C. It's got all these other micronutrients. So when you're eating it, you're not eating too much sugar. You're getting it along with all these other things. That's why it's not an empty calorie, the calorie being the energy. You're getting all this other goodness along with it. So that's why sugar in fruits,
like dates,
is fine versus sugar in a soda, not so fine. And you even for fruits, you don't want to be eating too many fruits. You don't want to be like obsessed with eating, mangoes or pineapples or whatever the sweet thing. But the same thing, like you don't have to drink too many sodas either. So this is where I say, when it comes to cancer, because let's bring it back home to cancer. There is the people who study metabolism in cancer have indeed shown that sugar, glucose, is part of cancer cells' metabolism. But hey, it's also part of our regular cells' metabolism too. Cancer just grows faster, so it really kind of fires up the metabolism of a cancer cell. But and in a lab, if you put lots of sugar in a dish growing cancer cells, you will fire them up. They'll grow fast. All right. But that's different than in a patient. So listen, I mean, I can talk about the lab. I like to talk about what happens in people.
Yeah.
In people, all right, if you're a cancer patient, you have a cancer in your body, and by the way, we all have microscopic cancer in the body anyway, that sugar that you have from a piece of fruit, from a tomato, I mean, there's sugar in broccoli, okay? Once it gets into your body, your metabolism is going to sense it. It's going to release insulin. You're going to draw that energy right into your cells and store it. And the blood levels might go up a little bit. Then they come right back down. You're going to be just fine. Your body's going to use that energy wisely. All right. But if you're a cancer patient, and by the way, the tumor won't get very much of it at all. Your body's so efficient at drawing it in. Now, if you got diabetes, all right, and you already have problems with processing sugar and your blood sugar levels on average are pretty high, all right, maybe be careful about how much sweetness you're having from anything. But I would still encourage you to eat fruit because there's lots of anti-cancer properties in the dietary fiber, all right, and in the polyphenols that you're eating. So don't deprive yourself of fruit, but do deprive yourself of that extra added sugar that's going to overwhelm your metabolism, right? So that I would recommend people to cut down or cut out if you're a cancer patient, like all that extra added sugar.
Yeah.
Stay away from cakes and candies and cookies if you can. Stay away from sodas if you can. All that is added sugar. but rather start adding some of the sweetness. You want to get a sweet hit for your brain.
Yeah.
Get it out of fruits that will give you all these other polyphenols and dietary fiber. That's actually flipping the switch. Or flipping the script, I should say, against cancer and food, because now you're using the things that are sweet to your advantage.
That's really good. Yeah, I love your approach to that in terms of avoiding the absolutes and stuff like that, especially with all the things we just listed. And so we talk about like stuff that we should add. What would you say are the things that have like the most research behind it in terms of things that we can consume on a daily basis that would be great as
well, my book, Eat to Beat Disease and Eat to Beat Your Diet, I actually have like 300 foods in total. Yeah. I've got a YouTube channel. I talk all the time about different foods that are good for you. So, the bottom line is that there's a lot of foods with a lot of evidence. If you're asking me like where are some of the strongest evidence, like it's sort of like this is a no-brainer. You'd be asking me like what are the things that I naturally gravitate for in my own life, because I know it's good for me. It's got like, and if you want to talk about cancer, I can talk about that too. But I can tell you like, let's start with what we need, which is hydration, right? We all need to stay hydrated. So I would tell you there's 3 beverages, I call them the Holy Trinity, that are healthy. Water, don't underestimate water, but if you drink water, drink it. If you drink commercial water, drink it out of a glass bottle. Don't drink it out of a plastic if you can avoid it, because now we know plastic sheds microplastics in there, and microplastics accumulate in your brain, in your blood vessels, in your testicles, and they're everywhere, and they're going to trigger inflammation. So it's better not to do it. Anybody who wants to, this is a project that's worth doing on an individual level, right? Listen, for years, when you go on vacation, you go to the beach, you go to a ball game, what do? You bring a bottle of water with you, right? If you're taking a thermos, like to the gym, get a thermos that is got glass in the middle, like the insulated glass or metal. That'll be better. Okay. If you're going to get a bottled water, don't get plastic. Get glass whenever you can. All right. Plastics is everywhere, but this is good best practice, modern best practices. The second beverage that actually is good is tea. Green tea, black tea, fermented teas like pu'er tea. These actually are really good. They deliver the polyphenols from tea. Some of them also help gut health, good gut health, good immune health, good brain health, that trickle effect of all the goodness. So tea, but don't add sugar to it. And I would recommend you don't add dairy to it. Like in English, in English afternoon tea, they put milk or cream in their tea. I would say have it straight like they do in Japan or China, okay? And the reason is because the dairy fat of cream will actually form little soap bubbles that'll trap the polyphenols, the catechins in your tea, so you're not getting the full benefit. Now, nut milks will not do that. So if you have almond milk or oat milk, that'll be fine to do if you want to cut your tea down. So the second of the Holy Trinity is tea. Third is coffee. Again, don't add sugar to it if you can avoid it, and don't add dairy if you want all the polyphenols. Coffee has something called chlorogenic acid, all right, and it's also got caffeine. In fact, caffeine is good for brain health, and also it's got ferulic acid, also good for you. So coffee is one of those beverages that we don't even know the history of coffee because it goes so far back. But people have been drinking coffee for eons, and coffee has been shown to extend longevity, slow down cellular aging, improve immune health, improve gut health, improve mental health. Like it actually makes you feel more positive as well, like a happier. So the fact of the matter is that those 3 beverages are key. Now, other main categories I would say that are definitely good, and I try to put them into bundles, are like leafy greens. You choose the ones that you can get that are seasonal, grown in the healthiest way, whether it's bok choy or whether it's kale or whether it's broccoli or broccolini or broccoli rabe, whatever you prefer. And I know people go, oh, those are vegetables. I don't like vegetables. Well, you know what? If you think about the Mediterranean diet, if you ever travel to Italy or Spain or south of France, they don't have a vegetable side. They just have vegetables as part of the meal, and they're absolutely delicious. So they don't have the stigma of being like something special that are medicinal in value that like you have to kind of like grudgingly shove down your shove into your body. They're absolutely delicious. So I would say greens. Tomatoes, uniformly good for you. I know there's a rumor, and I love to bash these myths. Like I take out Thor's hammer to smash these myths. Tomatoes are nightshades. They got lectins. All not true. Tomatoes are great for you. Great source of vitamin C, great source of hydration, great source of lycopene, great, improves your metabolism, lowers the risk of prostate cancer and breast cancer, and actually helps you feel happier and less depressed. It helps your serotonin in your brain. Look, there's nothing wrong with a really nicely, with the tomato. So that's a whole category. I would actually say that I'm drawn to. Allium, garlic, onions, scallions, those are also really great for you. And they make your food taste really good too. Flavors, spices and herbs, rosemary, basil, oregano. Sound familiar? Like, going to the Mediterranean? Listen, if you came to my house, I could take these ingredients and whip you up a delicious meal. You wouldn't think twice about the health, but I would let me do the heavy lifting to think about that. And the point is that we don't have to actually suffer to eat really well. Those are some of the big broad categories. And berries, of course, fruits. Berries are great. All the different berries are powerhouses. Do you know the berry that has the most dietary fiber?
Strawberries?
Raspberries. Even though they seem light and small and hollow on the inside, they are packed with dietary fiber. So you want to actually feed your gut bacteria, get good gut health in an easy way, just have some raspberries in the morning. Kiwi is a really good fruit. Avocado, also really good for you. I could list all 200 or 300 of them.
No, that's really good. And, we'll put the link for the book, and then also, your YouTube channel, you have a number of videos on anti-cancer foods that you've done that I think are really great, and people could like dive into that. And I love that you also said that, in the book, you have this whole list of foods. And so it's like, pick the ones that you like eating or the most, or you feel like are most available to you. And so that's a very approachable thing for people. So the last 2 areas I wanted to get to, is there anything you would recommend with screening for cancer, like in terms of like what people should be regularly doing and at what age they should be doing these things for? Obviously, it's better to, we're going to do the prevention, but it's also better to catch things very early than later on. And so what would you say about that?
Sure. Well, screening is really for early detection. Yeah. The earlier you detect cancer, the more likely you're going to be able to get through it, lick it, take care of it, and not make it a big deal for you. I wish there was sort of like a 3 bullet points I could give you on, cancer screening. What I would say is there are guidelines out there for different organs and different types of cancers. And really, maybe the best way to think about it is this. If you have a history of cancer in your family, all right, especially like the cancers that tend to run in families, breast cancer, colon cancer, for example, kidney cancer, those should be, if you have that in your family, all right, that should be kind of like a signal that you might want to watch out about these things. And what I would say, speak to your own regular GP, your primary care doctor, about what would be the proper cancer screening. If you want to look it up, go look up cancer screening ages, and you'll find a whole list of different types of cancers, everything from thyroid to colon. And we don't screen for everything because we try to make the screening non-invasive. Some things you need a biopsy to really look for. Hey, you know what? First do no harm in medicine. So I would say you should screen for breast cancer if you have a family history, and then, around perimenopause, definitely start doing, like in the 40s, start doing your mammogram. That the number, the age changes with time. There's politics associated with that. Same thing with colonoscopy. Once you, reach a certain age, used to be 60, now it's 50. Now you got teenage colon cancer. Who knows how early we should be going? It's a moving target, but there's nothing beats actually getting a scope in there and taking a look to see if there's any polyps. Oh, maybe you're a polyp former. Maybe your dad had, or your uncle had, or your brother has lots of colon polyps. You know what? Maybe you're a polyp former too. Those polyps which might not be cancerous, could turn cancerous. Better find them, better get rid of them. They just snake them out. They put a lasso on them and pull them right out. Okay. That would be screening. Skin cancer. If you're light skin, if you live in a sunny climate, people from Australia, for example, people in the South, if you've had a history of lying out in the sun and getting lots of sunburns, if you're somebody who used a suntan booth to get a tan during the wintertime, probably worthwhile getting a skin cancer screening as well, because melanoma, easily curable if you catch it really early. You wait for it to, invade your skin and spread. That's a different ball game altogether. So those are some of the things. By the way, the other thing that is, I'm going to try to come up with some things that people might not know. Lung cancer in women is becoming more common. So even in women who don't smoke, surprisingly, they get lung cancer. Do we understand why? No, actually not really. But young women who are non-smokers can get lung cancer. That's why, anybody who's out of breath, any woman who's out of breath or finds herself unusually coughing, check with your doctor, see if, it's reasonable to get an x-ray just to make sure everything is okay in there. I'm not telling everybody to go out to do it, but I'm saying that we're seeing that. Another cancer you might not think about, here's a good one. Head and neck and mouth cancer. How do you get mouth cancer? You get it. It turns out there's a rising epidemic of oral cancers, okay, squamous cell cancer of the mouth and of the throat. Okay.
Is that a dental thing?
Nope. It comes from HPV, human papillomavirus, right? So now young kids get vaccinated against HPV to prevent. By the way, I know that vaccines have become kind of like a triggering word, but I will tell you that last year, because of the success of vaccines against human papillomavirus, HPV, the rate of new cervical cancer was 0. Wiped it out completely. Okay, that's how effective it is to get rid of this virus that could sit around to get cancer. But one of the things that if you talk to a head and neck doctor, they'll tell you that they're starting to see that oral cancers are starting to become epidemic. Why? Well, put the picture together. Yeah, how do you get HPV in the oral pharynx? Oral sex. The sexual revolution. Think about before we had any vaccines in the 80s, 90s, the aughts. Now we're starting to see the results of that. And again, that's a whole other area that cancer researchers are trying to go after to see if we can find early detection and early treatments. And the early treatments, ideally would involve immunotherapy.
What do you think of Pernovo and the idea of doing full body MRIs? That's becoming popular.
You know what? What do I think of the whole body screening? I think if you can afford it and you want to take a look, go for it. Check it out. It's like doing an X-ray of your whole body at a very detailed level to look for things. I know there's a criticism out there that sometimes you find things that you that might not matter, like an incidentaloma. But you know what? Listen, these are the same people that are having implantable glucose monitors and checking their blood glucose every hour as well. It's just at a more invasive and a radiation level and a more expensive level. We live in a free country, so if you can afford it and you want to do it, I don't have an objection to doing it. But I think that people who become obsessed with it and think that it's going to answer all their health questions, it's really kind of it's a little overkill.
Yeah.
So I don't generally recommend it. But, some people, I've talked to some people who are really curious, and I think that's fine. And, some of the doctors who criticize doing it, they also used to criticize doing, imaging of calcium in the coronary arteries. That was once controversial. Now it's pretty standard to do it. So, again, people don't understand that there's a sociology to the medical community. Things that were really advanced before, they're not proven yet. And then after 20 years, they become standard of care. It's a no-brainer. So I just think that, again, it comes back to the source of information. How do you find the places and the people that you trust to give you fair and balanced and science-based information based on what we know today? Because we're going to learn more things tomorrow. And how do you not get overwhelmed and confused by all the information that's out there?
Yeah, that's good. The last section really, if cancer is already something that you have, I think it was another interview. You said it was like now is the best time to get cancer in terms of treatment options. And even if you talked about earlier, like the last 20 years, like the advancements that we've made, and it seems like a lot of the leading treatments or breakthrough treatments relate to those defense systems that we just talked about. And so can you unpack what those are and like why they're effective? Obviously that would be different probably for different types of cancers and who the person is, but.
Well, what I would tell you is that the single biggest breakthrough in cancer treatment in the last 100 years, hands down, is immunotherapy. These are treatments that are not chemo. Don't make a mistake, it's not chemo. These treatments wake up your own immune system. And as we talked about earlier, your own immune system is responsible for wiping out cancer all throughout your life. So you're just supercharging, revving up your immune system to go search out and destroy cancers. Now, this was kind of immunotherapy was sort of a pipe dream for many, many years, for decades. People have been looking for this. And then finally, about 10 years ago, 15 years ago, it became reality, like breakthrough by the biopharmaceutical company, biotech companies. We have immunotherapies and they work. They have been FDA approved. So anybody who's cancer should be having a conversation with their doctor. All right. Can I be treated with immunotherapy? That's a question every single cancer patient should ask their doctor. All right. That's advocacy. And by the way, before you ask your doctor there, you might want to go onto Google, okay, and look up immunotherapy and type in, search for the type of cancer you have to see if there's anything that's already approved, because you're not testing your doctor, but then you're loading up your own knowledge. And, oh, wait a minute, there are some studies that show that this can be used for my type of cancer. And that way, if your doctor says, nah, not for you, not going to work for you, say, I beg to differ. I looked up this research article and I can tell you that it is being used, or it has been used, or it has been successful. That's advocacy as well. There's a lot of downsides to having too much information. But when it comes to doing your own research, I do think that preparing for a medical visit, this is an area that would be useful. So immunotherapy is a big breakthrough. Targeted therapies, you find the mutation, you hit the target, you cut off the blood supply to cancer. These are all breakthroughs that are not chemo. They actually, and not radiation and not surgery. These are the new generation of cancer treatments. But I want to say one thing about cancer treatment that I was asked to give a keynote in England last year to talk about, the transformation of cancer treatments. And what I presented was that, when we think about what happens, the goals that oncologists have to treat cancer, it's destroying the cancer, killing the cancer, burning it out, poisoning the cancer. And and using chemo and that entire vernacular, the language, the vocabulary, the war against cancer, everything is really aggressive and scary. All right, it's violent. Is because where chemotherapy came from?
Where?
Came after during World War II. There was a secret mission to bring mustard gas to try to attack the Germans. So U.S. actually snuck a battleship there against the Geneva Convention. All right, so this is the U.S. government way back when. They put it like in a ship that shouldn't be carrying weapons. The Germans heard about it, intelligence leak. They flew planes over, bombed the ship. They didn't know it was mustard gas, but there was mustard gas in it. And mustard gas came out in Bari, Italy, and poisoned a ton of people. But they found that some cancer patients actually survived. All right, and that was the birth of chemotherapy with mustard gas. And that's why all of this cancer the verbiage that we use with cancer therapy is around war, destroy, burn, kill. All right. But now it's different. Now we're using the biological aspect, the functional aspect of cancer therapy. We are moving away from killing the cancer, which usually doesn't work, right? Very long. It might work for a little while, but usually the cancer will come back and kill you. All right. We're moving away from killing the cancer to healing the person, taking a more global, integrated, functional approach, including immune therapy, supporting the microenvironment, getting gut to be healthy with medicines, but also with diet and lifestyle. So back to, what you were talking about at the very beginning, we'll stick the landing on this thing, right back to the beginning, which is what's the advantage, the difference between conventional old school medicine, which is all based on writing prescriptions and doing surgery, versus the functional holistic. I would say that cancer as a field, oncology is a field where we are rapidly making strides to move away from the past, which was based on killing something, to healing something. And if you want to actually be healthy, you want to focus on healing and focus on health. That's really where the name of the game is when it comes to health and wellness.
Do you feel like that's the difference between, I think some people are so concerned that there's a lot of people who had cancer. I don't know if they went through chemotherapy or something else. They got rid of the cancer, and then 2 years later, the cancer's back, and they do it again. They got rid of the cancer's back. And so how is it that somebody has quote unquote no evidence of disease, with their cancer, and then all of a sudden it comes back? What's happening in the body there? And do what you're talking about relate to that in terms of the way we go about trying to...
I mean, look, we could do an entire podcast on the biology of cancer and cancer recurrence. Yeah. But the bottom line is that most killing of cancer cells in one spot, you haven't really wiped them all out. They're still floating around someplace. There's these little what's the right word? Sleeper cells, like little terrorists that are hiding out. Some of them will eventually wake up, and it's called recurrence. But that's just relying on the drug to kill the cancer to begin with. If you actually boost your immune system, you train your immune system, and now your immune system is just doing patrols, okay, you're more likely to get a durable response. Now, immunotherapy doesn't do the trick for everyone, but we're seeing it happen more and more. And so we're going from the first case to a few cases to more cases, and researchers are doing gangbuster style research to try to figure out how to make immunotherapy work for more people.
That's it. That's really good. Last question. I mean, I felt like I really wanted to ask this because it's become a hot topic. I don't know if you're familiar with Walter Longo's work. He's just coming out with that book, Fasting Cancer, or it's an English edition now. That it's been fascinating to me in terms of first of all, doing fasting while I guess traditionally doing chemotherapy or something like that, or why fasting in general would be something that helps with disease. Do you have any thoughts on that in terms of because we're talking about treating cancer?
A whole other podcast we could do, a whole other hour and a half, whatever you want to do on that. Look, when you fast, which is removing caloric intake for a period of time, your body resets, it reboots itself. Okay, think about a Control-Alt-Shift on your or on with your hard restart of your computer. When you fast, that's what you're doing to your body. You're rebooting your gut microbiome, which lowers inflammation. You're rebooting your immune system, which you need to fight cancer. You're actually rebooting inflammation, your inflammatory cells. And so, in a nutshell, and I'm oversimplifying what Walter Longo talks about, fasting will actually do this kind of hard reset. Ketones, that's a whole other kind of metabolism. And, that gets into the real nitty gritty with Thomas Seyfried and all these other people. Okay, that's also part of the equation. It's not the only part of the equation, but it's part of the equation as well. I don't think you can live very nicely if all you do is live a ketogenic life. So people that do practice ketogenesis and fasting in cancer patients, and you can find them on the internet. I mean, there's one guy who is a friend of mine who I know. His name is JJ Trochon. former Air France pilot, had kidney cancer, just had some surgery, never had any other treatment. He uses fasting and diet to actually, and lifestyle to manage his cancer. He's been like 14, 15 years without the cancer being a problem. It's really amazing. So this stuff works, but it's not mainstream. I mean, I think to say, forget about the regular treatments and just do ketogenesis or just fast, again, that's that oversimplification of just give me the formula, and I'll do it.
Yeah.
And some people say, I'll do anything to avoid chemo. I know somebody right now who is saying, I don't want chemo. I'll do anything but chemo, but I want to live. Okay, first of all, some of the treatment, and she lumps every treatment under chemo. Okay, so I would say, the God is in the details. And this is where, you need to do your own research and realize and find good trusted sources to pick apart that combination of things that's going to personalize the treatment to you. And for, many people, I think Walter Longo's program actually could be very, very beneficial. He's a very smart guy. I know him. And I think that he's one of those leaders that has worked out kind of a metabolic plan for overall health and specifically to fight cancer.
It's really good. I feel like this was just a masterclass on the topic. And yeah, I just appreciate your time. You have a lot of amazing content online, and we'll link out to all your socials and your channels and then your books as well. So I feel like there's so much follow-up that people need to do with, specifically with the foods and stuff like that. So many great videos you have out there. So yeah, I just appreciate this. And I think people are really going to feel a lot more equipped and educated from hearing this. So thank you so much.
Well, I mean, I'm putting new content out on my YouTube channel. It's Dr. Dr. William Li, LI. It's a place where I actually answer questions that people send in.
Yeah.
So, I get so many questions. I can't answer them one by one. So I kind of group them together. And that's why I use YouTube as a platform to be able to kind of get the information out there. But yeah, come to my website, drwilliamli.com. My handle is at Dr. William Li, and my books, you can buy them anywhere books are sold.
Yeah. Well, thank you so much for being here.
Thanks very much for having me.